So sciatic nerve is one of the most common areas to get a nerve entrapment in the body. And basically what happens is the sciatic nerve comes under here, and then a lot of people think that it gets caught on the piriformis. The piriformis goes over top. The sciatic nerve goes underneath the piriformis. So they always say, oh, you have piriformis syndrome, that's the problem. What it is actually something deeper in one of the external rotator groups. So in the external rotator groups you have superior gemellus, inferior gemellus, obturator internus, and quadratus femoris. The most common area where you're going to get it caught is going to be on the superior gemellus, because that's where the nerve has 80% of its function. So 80% of its contact in there. So I like to play the percentages in the data. So instead of being like, oh, well, 5% of the time it happens in piriformis, 80% of the time is in there. So that's where I'm going to start, where it's more common to have that in there. Now for the palpation of this, I'm going to have you come back here a little bit. Yeah, you're perfect right there. And I'm going to have them lying right down the side. So you guys might want to come over here or over on this side so you can see.
Give me a video.
And with this one, what we want to do is we want to palpate it under a little bit of tension. So I'm going to bring their leg over just like that, and it's going to set down just like that. So right about just a little bit, just below 90 degrees. That kind of opens that up, it becomes nice and relaxed. And for this one, is it okay if I roll these up just a little bit? So we want to roll these up just a little bit to expose the hip and the sciatic nerve. So always ask, just be nice. So for this one, what we're going to do is roll this up just a little bit, just like that. And that's going to expose this area. How are we doing? So it's going to expose this area. So once again, I love landmarks, right? Landmarks tell us where to go, specifically big bony landmarks in there. So in order to find the sciatic nerve, what I find first is the trochanter. Right there, it's that big bone, you can't miss it. Then on the back part here is the lateral part of the trochanter. So see, I go big bone, then the smaller bone, and then what I can do is I sink right into this space. And that space right here is where I sink in. This is where the hip capsule lives, right up against the bone in there. That's something we treat in the hip functional test. So that I kind of sink in, and that's the capsule. Now to find the sciatic nerve, what I need to do is bow my hand around, and what that does is allows me to go in and feel on that sciatic nerve. And we're going to do what's called, we're going to get the depth, and then I'm going to bow it. So what we should see is when this is caught, is it not bowing where it should? So right up here, that's all piriformis. It's a little thicker in there, and then gemellus is deep. So a lot of people treat on piriformis, but that sciatic nerve runs right here, and where she's caught is right in through here, and you can see how it's tender in there as well. So that little bit of difference makes a huge difference. So here, remember, trochanter, lateral part of the trochanter. And in my training videos, these are all in here, the detailed palpations as we go through. So trochanter, lateral part, space, that's capsule. But now we want to turn that thumb over and here and bow and feel. So when the nerve is caught, it doesn't sway back and forth. So down here, when I'm sinking in, see how I can move that? And it's not as tender, right? But then as I work my way up, right through there, that's like I'm hitting a brick wall right through there. So that's where my scar tissue is going to be, and that's where I'm going to apply the treatment. So I'm going to be treating the sciatic nerve at that area. So take the time to palpate and find it, and open that up. And even if you're first going through and palpating, go in there and draw a little marker on it too, so you have that area to kind of go from there. But once we'll set up the treatment, we're going to go just distant to that and go right into it as well. So let's start with just palpating it and finding it, and then seeing if people have it, and then we'll mark up those areas so we can have it. Then we'll go in and actually clean up that muscle. Ready? All right, so we're going to be treating sciatic nerve at superior gemellus. Patient-client position is so important. So what I like to do is have them come right to the edge of the table, lined up like that. And I even have her come a little bit more towards the edge here. And the first thing that we're going to do is we're going to bring this bottom leg back a little bit, so it's kind of parallel. And then this one's just going to drop right here, right along the table. And that's going to be a really good position for palpation and for treatment. And that's going to open that up as well. And the first thing that we want to do is go in and palpate it just like we did before. Always ask, is it okay if I roll this up? So we're going to go in through here. And we already marked her earlier. So remember, trochanter, back of trochanter, that sinks into that space. And then as we go in, we're going to go here, depth, bow, depth, bow, depth, bow, and she's caught up right there. So when you're first learning it and getting it, draw a little bit of a dry erase marker on there. So now you know. So that spot's already there. Now the movement for the client is going to be really, really important. We want them to have their leg down on the table. We don't want it to be up. Like some people will start it here. And when we're up like that, the glute med will kick on and actually kick us off. So when we have it down here on the table, it's nice and relaxed. And the motion for this one is once I'm ready, she's just gonna start to drag her leg up. Just like this, nice and free. And right about that motion from where we are. And it's just gonna be a very slow, gradual push as we go in there and open it up. And then you'll see me kind of come around here too. So the key here is using your body and your leverage from where you are. And we always wanna get that sternum over the top. That's why when we practice our depth and tension, we practice dropping our sternum because it all correlates in here. So the key here is all in the setup. So very similar, I'm never in a rush. I approach the client like I'm gonna get in there, but I'm not trying to go fast. So this one, what we wanna do is we wanna be able to get our sternum over the top of it. So I'll have her right here, and I'm gonna be just slightly behind it. Start your leg right there, because I don't wanna have it in between my legs because it's gonna get caught. And actually scoot down just a little bit more towards me too. There we go. So we're gonna be here and here. So the first thing we're gonna do, we're gonna come in, trochanter, back of trochanter. This is capsule. We're gonna spin that over, here, 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 and she's caught right about there. So we're gonna go just inferior to it, like we said, 1/4 of an inch down there. Now, my hand is gonna be just like that. So once you find it, keep your thumb on there and keep it on the space. Where we talked about once you get the hands lined up, then we get the body lined up. So now we're here and I'm here. And the first thing that I'm gonna do is we're gonna do that lock and key like we talked about. We're gonna lock that in just like that, and we're gonna be here. And what I like to do when I get my depth is I have my arms just slightly bent. And the first thing I do is I go right up on my toes, and my depth is a lean in, like that. My secondary depth is going to be a pec push here, and then my tension is going to be a lean away, just like that. And she's going to start to move her leg, and I want to keep my sternum over top of it.
So you're
Keep going until they can go. And I'm keeping my sternum over top. And then what I can do at the end here to help it a little bit more is give it a little bit more pressure through there. And it's going to be really intense because when the nerve is inflamed there, very good.
And so do you still do like a 3 count? Like 3 count? Like when you hold it?
No, because it's a nerve. So the only thing that we hold deep in there is going to be a ligament, because the ligament just is deeper, so in the capsules anywhere else. When it's just the nerve entrapment, we just go through and get that pass in there. So you notice here, once I put my hand on there and I kept it there, I'm not moving my hand because I've already done that work to do that. So now I can get myself a little bit more set up. So we're gonna get in here and get another pass. And this time I'm not gonna do the push with the pec. I just want you guys to see what my hand would look like as we go in there. So I would get my depth by coming up on my toes, sinking in, be a little bit higher here, and then my tension would be across like that. So go ahead, and it's internal slide because it's coming to me and opening up. And as I'm doing that sciatic nerve, I'm holding back the sciatic nerve, and I'm forcing that muscle to go underneath, and that's what frees it up. So here, you'll be able to feel the difference when I can really back it up and get my sternum over the top. It is a lot of good deep focal pressure. Push through that thumb here, and go ahead. And then when it starts getting inflamed, that's already moving better.
Wow.
Good. And now the key will be, she was 71. Let's see what she got. So we always want to remeasure. Here, even that out. So we're gonna add.
You go back to that one, basically.
What's that?
You go back to that 1 degree because she was off like.
Yep.
Yeah, she's in this one. She's even at 0 now, so sometimes it'll clear itself up. Here. 95.
Yeah.
Yeah, that's a good change. How's that feel?
A lot better.
Yeah,
And
good.
a question, does it matter if her leg that you're not working on moves up a little bit?
It will compensate a little bit, nothing crazy. Not as big as when we're doing the hip test.
Gotcha.
From there. So what you see is the palpation is really important. Getting on it and finding it and then using that leverage. Everything builds up on itself. The depth, the tension here, it all translates there. So now when you go back and watch the videos and you see that, you can look at those little things that I do, like, hey, I'm up on my toes. But the concept is always there. Depth, back out, then tension. Cool.